Welcome to Transplantation and Transplantation Direct Journal's Editorial Fellows webinar presentation on transplantation and social media, from global impact to personal practice. Our moderators for today are Priyadarshan John from India and Jerome Duzit from Belgium. Our distinguished panel features Macy Levan, our journal's social media editor, Frank Dorr from the Netherlands, and Augusto dos Santos Jr. from Brazil. Let's dive in.
I'm joined by my co-moderator, Dr. John, who is assistant professor of nephrology, Osmania General Hospital, Hyderabad, India.
Thank you, Jerome. We are excited to have you all with us to explore how social media can enhance communication, education, and engagement, not only with the transplant patients, but also with the health professionals and the public. Before we begin, just a quick note. Today's webinar will last for approximately 60 minutes. Each of our three speakers will present for about 10 to 12 minutes each, and we'll have time for the audience questions at the end of the webinar. So please submit your questions in the Q&A box.
So, we have three objectives today. So first one is to understand the evolution and impact of social media in transplantation. Second one is to learn strategies to design and measure effective organ donation campaigns. And the third and last one is to identify the best practices for professional and ethical social media use. I don't know if it's working for you, Macy, because this is our first presentation with Dr. Macy Levan, Associate Professor of Surgery and Population Health at New York University Long Health, United States, and the social media editor and podcast host for Transplantation Journal. And her presentation is how social media has been used in transplantation.
Well, thank you all. I really appreciate the opportunity to share some of our collective research in transplantation about social media. Thank you for the introduction. There's just a couple disclosures. For context, I do serve as the social media editor for the journal, and I serve on the board of directors for the Children's Organ Transplant Association, and I have written extensively on the topic. You'll see I've shared some of the papers today with you. So what is social media, right? We spend so much time doing it that sometimes we often forget what it is. And social media really is what allows users to create content, interact, and to share. Likes, comments, geotags, lives, stitches, every one of these actions is really part of what the public perceives and sees in our public health ecosystem for social media. So patients and professionals aren't just receiving information, they're producing it now. And I usually have the 3 V's, and I talk about social media as being viable because it's where our patients and public already are. It's visible because we can amplify accurate education. And it's varied. There are various and varying perspectives on the topics, right? So if we really want to meet people where they are, they're scrolling. For patients, distance and time zones flatten with social media. So a mother in the United States in Kansas and a donor family in Brazil and a recent kidney transplant recipient in Japan or India can normalize and be in the same room during social media. So they tell their stories, they advocate, and they normalize transplantation and recovery. You can see here is a global overview of social media use, and it is continues to be a primary form of communication for those around the world. There are some various social media platforms in transplant outreach that we have focused on, and those are Instagram, TikTok, Facebook. There have been some papers published about Reddit use, which is in the United States, we call Reddit the front page of the internet. So sometimes it'll show up on Reddit and then it will show up in other sites later. Twitter, which is now called X, and LinkedIn, which we have found in transplantation to be an incredibly useful social media platform. Social media really bridges distance between time zones. As you can see, I'm presenting today with my colleagues all around the world, and we all have a shared interest and collective responsibility, I think, to really ensure that the global transplant community understands how powerful social media can be. It certainly is empowering individuals and raising awareness, but it's also important to reduce stigma, and I think that happens often. This is an older study that we published in a journal. It was one of the original studies that was published about how the transplant community, or a big group in the transplant community, is using social media. And one of the things we found, this was published in 2019 under my old name, Henderson. And you can see we surveyed the society, the American Society of Transplant Surgeons. And at this time, most of them believe that social media should be part of modern transplant communication and referral strategies. But they were also really nervous about missteps here. And so the tension between those missteps and opportunity really has been shaping the future guidelines and opportunities that we see for social media. ASTS members, back when this was published, they mostly used social media to communicate with their family and their friends and other surgeons and other transplant professionals. And most that responded to this survey really did think that it was okay and ethical to use social media to increase and improve living donation. And we'll hear a presentation about that from my colleague, Dr. Dorr, later. One of the other major kind of aspects of science that we wanted to understand was, if you're a transplantation reader, what are you doing in social media? What are you using, and what are you, what platforms are meaningful to you from either the journal or from the society perspective? So there's a lot of data here. We did publish a paper after doing some recruitment to all of our readers. And the key points that I'd like to point out here were that the top platforms used by the Transplantation Journals network are LinkedIn and X, which is now Twitter. Scientists and physicians also use social media to promote their own work, their own network, their institutions, and connect with patients. And over half of the clinicians that we surveyed told us that they were open to discovering and sharing research on social platforms. So, the next major scientific impact may not be in someone's feed, or it may not be a PDF, it may be in someone's feed. And so we're really taking this as a data-driven approach to understand what the best ways are to promote social media for the Transplantation Journal and the Transplantation Society. We also took a look at Instagram. That's actually my personal favorite social media platform because I still know how to use it. I'm not out of date. And it appeals to the demographic with the highest number of medical students as well as residents. It heavily emphasizes visual content and has really become widely recognized as an educational tool in medicine that relies heavily on these, visual aids. And transplantation fits really good into this category. So we did publish a small paper that kind of describes Instagram's use in transplantation. And we were only able to do this in, a certain temporal setting, right? So you can't do a study over a long period of time because it wouldn't be as scientifically valid. But we looked at 75 posts on Instagram, and we kind of found out that there's really powerful educational outreach going on here, but also really emotionally complex ones. So you have recipients wearing hospital gowns and lots of, tens of thousands of interactions with a lot of those posts. So that's something that our formal communications and our science rarely receive. And so within transplantation, we found that Instagram is most commonly used for the patient side, as well as nonprofit organizations and academic institutions. TikTok, I tried this. I still don't have it back on my phone, but we did the same here. And TikTok really is where storytelling is exploding on social media. Our, quick snapshot here is telling us that TikTok is showing things like honor walks for deceased donors. It's talking about organ recovery from the transplant surgical perspective and trying to inspire the next generation of surgical professionals who want to come into our space. It's giving us pics of a day in a transplant recipient's life or a day in a transplant surgeon's life, as well as living donor stories. And so we really can't ignore the gravity and the risk, actually, of clinical content that can trend overnight, especially on TikTok. These are some stats of what we found, and it really is targeted towards the general public and patients. There are less scientists on TikTok, but more and more medical professionals every day using the platform to correct misinformation or to provide accurate information about their space. And I think transplantation certainly fits in that category. Here you can see some photos. There was an honor walk, and you can kind of see what's being shown on TikTok. But I do want to briefly mention before I wrap up here that donor families are really finding purpose and meaning and connection. I'm seeing recipients that are building communities and building hope. And I'm really seeing living donors who are modeling courage and generosity, which is something that storytelling can kind of heal us all for everyone involved. And I think there is a role and a continued role for this in transplantation. There's unique communities that are being formed with donor families, recipients, unique communities, and living donors are having very unique communities, largely on Facebook. But I think these are fantastic social support networks that are being created, largely unmonitored. So there's a whole other side of this, but it's still a peer support network where people can come together. Never underestimate the personal story that goes viral. And recipients are sharing stories. They're very common to see a donor family interacting with a transplant recipient. And, in this photo, one of my dear friends is hearing, the heartbeat of her deceased child in beating and living on in someone else. And those really touch people. And I think social media is a place where those happen and intersect with other media. Briefly, we wrote a paper many, many years ago when social media was a big question of, can we even use social media ethically in transplantation? It did have ethical concerns, and we created some recommendations, which ultimately vary by country and vary by professional society and norms. In the United States, which I can speak to, the organ procurement organizations really are the formal facilitators of this communication between donor families and recipients. But outside the US, that may differ. And so social media is also changing that paradigm. Privacy is important. We'll hear a little bit more about those things today, I'm sure, because there's really unintended consequences that can happen with disclosure of health information and donor identity. So I think it's really important for everyone to remember to always have explicit consent before sharing another person's image, story, or name, and really encourage that voluntary well-meaning. But really, ethical storytelling in a global context is here. We have the opportunity to do that. Use people-first language, honor humanity, and recognize cultural norms. And so if you have any questions about social media, you can reach out to me. Here are my contacts, as well as our wonderful digital media team at the Transplantation Society and the Transplantation Journal. I'll turn it over to the next panelist now. Thank you very much.
Thank you, Dr. Macy, for that insightful overview of how social media has shaped transplant communication and connected communities in new ways. It's really exciting to know and find that social media has its own vital role in promoting transplantation and other areas of transplantation, including organ donation. We now move on to the next session for this webinar. Our next presentation is leveraging social media to increase organ donation. It will be given by Dr. Frank Door. He's surgeon at the Erasmus Medical Center, the Netherlands, and also the current treasurer of European Society of Organ Transplantation and one of the former social media editors of Transplantation. We are delighted that he will be presenting today. And Dr. Door, the floor is yours.
Thank you so very much. I hope you can all see the presentation and hear me. So I was asked to talk a bit about leveraging social media to increase organ donation. I'm not a native English speaker, but I thought the word utilizing social media would be better because there is no profit actually to be expected in the monetary sense of things. But a real social media enthusiast, and otherwise no disclosures for this presentation. I do have a disclaimer to make, is that I am back in the Netherlands after working for almost 9 years in the UK and London. So I will give a little bit of Dutch and UK perspectives and some examples from social media in organ donation. And really, I think Macy already said it very beautifully. Social media is the place where humanity meets technology, and where technology also facilitates humanity, I would even dare to say. And I think we have a lot of urgency still to find more organ donors, because the organ shortage remains despite many, many efforts from many people in living and deceased donor programs. It remains the major barrier to doing more transplants, and people on the waiting lists are dying. So they're not just growing the waiting list, people are dying, and we know we can really do something about it if we had more transplants. Also, I think the traditional awareness campaigns that we all know, people go out on the streets with, and flyers and sending all kinds of unilateral campaign material, have a very limited audience. And also, the audiences are not interactive most of the times in the traditional media sense. In the social media, I really think it has become the new public square. We can shape health behaviors, we can mobilize people faster, and we can make them interact more quickly all over the world, as Macy had already said as well. And if you ask me, and this is a paper that we wrote together with a lot of social media enthusiasts a few years ago for Transplant International, I really think it's still underutilized. This is a quote of myself. It's an underutilized instrument in professional communication, especially when we really consider proper patient engagement in healthcare at the moment. And of course, personally, I have my boundaries across these platforms into personal and professional use. I think this is extremely important. But as a professional, we can really do more using social media for public education, raising awareness, but also trying to get more organ donors in general. And most of those, many of those are actually centered around living donation. But I think we need to use more of the impact and the power of social media. I think Macy has seen the same sort of papers as I've seen. It's not a surprise, obviously, but it's a very powerful tool with so many people worldwide using social media. So this is our real public square, 5.66 billion people. The time spent on social media is more than 2 hours per day. And of course, it's an amplification within trusted networks of personal stories and professional experiences, and it can go viral within hours. And cost effectiveness is also much higher compared to TV and radio, the classic media, so to speak. Actually, there's quite a lot of examples. I tried to look from all over the world, found, of course, Share Your Spare from the US as a campaign. NHS organ donation campaign, Leave Them Certain, Donate a Kidney UK, or Make Your Mark from the UK, and also Spanish ONT is using Instagram influencers to increase organ donation and organ donation awareness. And of course, there's individual stories of people that are the real experts, and also finding living donor matches. So if you look at the demographics of social media usage, there is a lot of difference per generation, and every generation now has a name, as you know. You can see them here. Basically, the younger you are, the more likely you use social media, but also the type of social media that you're using, the platforms differ per age category. And that's why it's so nice to have a plethora of different platforms where people find what suits them best. And you can see that, you can hear that from various people. I'm on X, but I'm not on Y. I am on Facebook, but I'm not on TikTok. People choose. So we have to also, when we make strategies for organ donation awareness and campaigns, we have to really look at who do we try to reach, and we can really try to reach everyone. Also, it's interesting, I didn't really think that necessarily that females are more likely to spend more time on social media around the world, but it's not that much of a difference, to be honest. Also, because we are doing a TTS webinar, it's nice to look at the global picture, that there is a difference in terms of where you live, where you are, and how much time you use social media. So Latin America is quite enthusiastic, but the Philippines really leads all countries with 4 hours and 50 minutes per day. And the others basically follow, with Europe being one of the lowest ones, and Japan also really low, which surprised me a little bit. And here you can see how popular the various platforms are. And as I said, many different generations use different platforms. So how we can change the narrative around organ donation and trying to get more organ donors, because we really go from abstract statistics that we present normally on TV and radio and journals, and we now move to real people. And I think this is the key. Real people make a real impact on social media. That's why it goes viral. And people, are presented with data around organ shortage, but with social media, people may think I can actually be the one who can make a difference, like this person. And I'm just showing here an example of one of my old living kidney donors from a couple of years ago in London, a guy that is really looking fantastically, but not a normal person to see according to many people, but he is a very great guy, and he's called everything from a Viking to a walking tattoo, but none of that matters here. A kidney is a kidney. It doesn't matter what you do with your hair, how you did your dress, and what your skin color is. Anyone can do what I did. A very powerful statement. It's just not a storytelling. It's sharing personality, and different people may actually inspire different people in a different way. So there is, people really respond more to faces and real-time stories that they relate to. If you recognize yourself in someone you see with a similar problem, or someone who's done something great, you may be more likely to also feel compelled to do this. And a 30-second TikTok of a living donor describing their recovery, as Macy already gave as an example, can reach so many more people than any hospital press release quite does. And us as transplant professionals, we looked at this in a European, like the ESOT era. We looked at a lot of people, and this is also quite some years ago. Many people are using social media professionally also. But people recognize, and this was 2019, similar to Macy's, a lot of risk associated to that, and we need to know more about this. But it's a recognized value for promoting donation, education, and research. But we need safeguards, and that's also underlined by Macy, and she presented this paper already, so I'm going to skip that. Interestingly, if you really look at the donor registration intent, my good friend and lab mate from Boston, Andy Cameron, wrote, of course, already in 2013, a paper on the Facebook effect, where really in just a matter of 24 hours, more than 13,000 new registrations for organ donation came about when he launched this Facebook Facebook campaign. And really powerful example. And there's even some randomized interventions that actually I wasn't aware about before I started looking in my preparation for this webinar, that they come from the same group, but there's two different New York City initiatives where people were exposed before a survey to an emotive educational video, and they were more likely, when they have seen that video about organ donation with lots of emotions around it, to register as an organ donor versus the control group. And actually, we are really lacking this sort of work, even though this is small studies and it's not the actual organ donation act, it's the intent, but it actually is one of the few evidence bases that we have. And I was actually surprised with that. There are good examples, both in the US, the UK, and the Netherlands, of living donor matches, of people that find themselves through social media. It's not allowed in many countries, and a lot of countries are very reluctant around this practice because they fear that all kinds of organ trafficking and payment is happening. But actually, we have quite good experience with social media solicited donors in all the countries I've worked in. And of course, campaigns run in partnership with influencers. I think this is very powerful to actually create awareness. I don't think it immediately will lead to registrations or living donations, but we also know that more and more people are likely to do this once they have been exposed to this. And also in China, there's an interesting study that looked at the media themes and actually what sort of public engagement will follow from which theme around organ donation on Weibo, which is a Chinese social media platform. And I think, there's lots of challenges and ethics around social media and transplantation and organ donation. We already know about the misinformation and sensationalism. Privacy and consent were already highlighted. And also the trust in us as an organ donation and transplant community is really important. And of course, we will never give the impression that we coerce people or try to manipulate people emotionally. So we do want to empower people and don't want to pressurize people. And there's a couple of papers that are associated with that as well. So I purely see opportunities for us as transplant professionals. We can partner with communication teams to really tell the stories and humanize transplantation, not just to engage donors and recipients as ambassadors, but also to promote research innovations in professional networks. And I really think that we should do more with our young colleagues to reach more people with responsible social media usage. And these are some initiatives that I was part of and still part of in London with the peer body support system in the Black community, really trying to get more people to donate as a living donor in the Black community, to the Black community or beyond, because this is so much needed and there's so much inequity looking at various ethnicities around the world in various scenarios in various countries. So this is highly needed. And unfortunately, these initiatives normally are not measurable in terms of what effect they sought. And this is our first priority, actually, that we have to undertake when we take more action on this. And of course, I think webinars are also very powerful to be shared. They're co-produced with patients. This is a recent one at Erasmus MC in Rotterdam where I work. And also there's podcasts by, for example, Dee Moore, Diary of a Kidney Warrior, where really good information can be shared on all kinds of social media platforms and actually lead for people to engage more and more. So where does it go? I think we need AI also to be integrated and have targeted campaigns for different people in the world. Building transplant influencer networks may be a nice and interesting option. And of course, with cross-border European collaboration and unified campaigns, this can be actually a global collaboration, of course. And this is, I think, the key. The last point is really using analytics. And I'm also talking to myself. We never really analyzed what happened with various campaigns at various stages of the campaign and how does it turn into donor registrations and transplants. So this is actually, I think, one of the most important messages of this talk, that we're really lacking this at the moment. And apparently there's a lot of different metrics we can use. So we need to get together and study this and make this more scientific to see also what works and what doesn't. So organ donation is really a human story. And I said already, social media is where humanity meets technology. And if used responsibly, it can really save lives. So thank you so much for your attention.
So thank you, Dr. Dor, for your very meaningful presentation. It's interesting you're utilizing rather than leveraging or taking profit from, because it's very differentiator into this aspect of the field and the promotion of donation, aside from money or to highlight people or centers, and it's very different from other strategies. These are practical insights, I think, that going to help many of the people in the audience or people interested into social media to improve donation campaign awareness and actions. So thank you very much for this presentation. We move to our final presentation, which is entitled "The Professional Edge: Do's and Don'ts as a Transplanter on Social Media" by Dr. Augusto dos Santos Jr., adjunct professor of medicine, nephrologist, and based in a hospital, Das Clínicas of the Federal University of Minas Gerais, Brazil. Dr. Santos Jr. is the former chair of the ISN Education Social Media Initiative and editorial fellow of Transplantation. Dr. Dos Santos, please go ahead.
Thank you so much. Let me share my screen. Do you see it? Is it functional? Yeah, great. So thank you so much, Jerome, for the kind introduction, and it's my honor, my pleasure to be here today and share with this with Frank Dorr and Macy, a great panel of speakers. My role today is to talk about the do's and don'ts, the professional use of social media. I don't have any conflicts of interest to declare, except that I'm passionate about digital education, and I have, and by being passionate, of course, I participated in some relevant programs, especially in the International Society of Nephrology, also in the Transplantation Journal. I have divided this presentation into three sections. Let's start by a brief introduction with some facts that were somehow already mentioned by my colleagues, but I would like to stress from a different perspective. So, as mentioned, social media nowadays involves around 5 billion people, but that represents a kind of 65% of the human population nowadays. And these numbers could be much larger than we see if we had an equal distribution of internet globally. Because when we look into the internet use, especially in those who have access to the internet use, it's estimated that in this population, 94% of them use or are connected somehow to social media. In addition to this, it's currently estimated by the World Economic Forum that around 36% of all the data produced in the globe is now produced by the healthcare industry. So if we put those two things together, we have the perfect scenario for leveraging the digital education. Actually, we have so huge amounts of data and a big audience waiting for information and actually seeking education and precise information to guide their practice and their life. So as also mentioned, we are on a great an exciting scenario for working and developing digital education tools, especially in social media. And then I would like to move on to a real case so that we can discuss some do's and don'ts. And let's pretend that we are a procurement team and that one of our members decides to, while in the surgical ward, to take a selfie and make an innocent post. And in this post, he just texts that, I'm glad that I have joined the team. Congratulations to all the professionals involved, an exceptional team, and an unforgettable experience. Actually, this is a real case that happened, and then in this person who did this post, she was suspended, and I want to walk you through on the reasons why that happened and why even in such an innocent, apparently innocent action could involve some actions that could be against some policies which are currently underway. So one of the important things that we should always make sure that we respect is confidentiality of patient and people involved in our actions in social media. So publishing photos, videos, or reports on clinical cases, even without directly identifying the patient, can violate privacy and break professional secrecy. Specifically in the case of Brazil, and Macy somehow touched on that there could be some variations from country to countries, but the identity of the donor is guaranteed to be anonymous by law. So the person who decided to make the post not only somehow identify that the donors, but all the team involved, and disrespect some governance and institutional policies. So in addition to that, filming and publishing videos of patients in delicate or vulnerable environments, such as in the emergency room, hospitalizations, is disrespectful to the person and can violate institutional governance policies. It's quite common nowadays in hospitals, especially in intensive care units or in medical wards, to see some signs telling people how they should proceed, and specifically telling about these kind of behaviors in terms of to avoid social media or taking photos or filming patients into the institutions. Now, adding to that, and not specifically illustrated in this case, we should always be aware of giving medical advice, prescribing treatments, or making diagnoses through social media networks, especially without a proper platform in the case of telemedicine, or without a face-to-face medical evaluation, because that could, depending on the country policy, but mostly globally accepted, that could constitute a legal practice and, of course, put people's health at risk. Posting offensive or prejudice or discriminatory comments towards patients, colleagues, or other people demonstrates lacks of professionalism and also can generate ethical and judicial processes, and also avoid disseminating news or opinions that are not based on reliable and verified sources. So these are basically some of the most important don'ts that we should always make sure that we are checking prior to engaging into any post in social media. So let's go to some do's. So respect for the diversity and combat of prejudice. Interaction on social media must be guided by respecting differences and combating any form of the discrimination. Preserving professional secrecy, as already mentioned. So confidential information about the institution or about patients should always be treated with discretion. And this is usually very well acknowledged on the governance policies of the institutions that you might associate it with. And always be responsible by your publications. So your comments must be ensure that the ethics and the quality of what is being shared is granted. All of these rules or guidelines, they're based on big discussions that have been undertaken by some global institutions. UNESCO is one of the leading institutions that had brought these themes to the public, and they have a great publication kind of driving some guidelines on human rights and the approach to digital education and artificial intelligence use. And also, the World Health Organization has performed some extensive debates on the importance of of having the use of social media to be used with responsibility, especially when we talk about the risks of misinformation and disinformation, and the risks that this kind of practice may bring to the health of our population. So always stop, think, and check prior to reposting or doing any post on social media. The International Society of Nephrology have recently, and this is one of the things I have been involved with, published a social media core curriculum where we debated and brought to very concrete actions how to use social media and in a professional way. And of course, the Transplantation Society and the Transplantation Journal have also engaged on social media, bringing innovation in his educational platform. And so it's now available on Instagram, as Macy also mentioned, and and using tools that make easier for the population, not only professionals, to access scientific findings and the scientific literature. So there are video galleries, visual abstracts, and so many other tools that are coming to the scene to help inform and educate professionals and the population. Now, just to wrap up what I have been discussing, take home messages. So don't share fake news. Don't discuss or respond to complaints online. Avoid heated discussions, controversies on social media, and always seek to be respectful and informative. Don't post information that may damage your professional reputation or that of others. And do create comments that is useful and meaningful. Check the source of what you are posting. Set a time commitment. Your the commitment that you have in terms of time may also affect you in terms of your mind health. So identify your audience, be unique and keep a professional language, and of course comply to institution standards and your professional conduct code on social media. Like to finally invite everyone to join and participate on the World Kidney Day campaign in 2026. Kidney health for all, protecting the planet, which is a great initiative, and also keep in touch. Uh, Thank you for the opportunity, and back to the moderators.
Thank you, Dr. Augusto, for that thoughtful and very relevant discussion in today's times. Your talk is definitely a reminder of how professionalism and authenticity should go hand in hand on social media. And definitely it has its own role in promoting education, and definitely surpasses the geographical barriers, which help us get connected with the global leaders and the global leaders and everybody else. So now we now have time for your questions. So please continue to send them through the Q&A panel. We will address as many as we can.
Well, before that, I'm going to start with the questions. So to initiate the fire, the first question is for Macy, but it should also be for Frank. Well, Messi, you live in New York, and New York is the city of Mad Men and Don Draper. This is all about advertising, so we're talking about metrics, about social media tools, etc. And I was wondering why we are not thinking about more professional tools like using marketing strategies, anthropology analysis, etc. To increase actually the message and to have something that's called maybe more tangible in terms of result and of analysis. The fact is that this is really something, and if we compare with ads, and back on what said Frank about the fact that we are not profit, it's because then we are shifting tools to this non-profit use of the social media. But still, the way we can get the more people involved and the more impactful message, etc., is always already a lot used into other type of marketing approaches and profitable societies. So what about these tools to be used in the future in TTS social media?
Right.
And yeah.
Oh, so let me comment on this. I don't know if I have an answer for you, but what I can say is, yes, I work in New York. I'm not a local, but I work in New York City, so I'm there a lot. And yes, social media marketing and the use of data around that, I think is very valuable, right? So what people purchase, what they look at, we are all numbers and data to someone, right? Like what I look on Instagram and I'm looking for, shoes, for example, which I'm usually doing. They know how to advertise to me. They know that I give talks and they know that I like this and that. And there can be strategies used to, for example, identify people who may be interested in being a living donor. And one of my colleagues in the United States has worked on this in something called generosity profiles. And she talks about this where they piloted this in a city in America, in Houston, in Texas, to see, hey, there's all these people out there. Could we actually target that? There, I think, is a large standing ethical challenge with that, and a large standing kind of ethics conversation that a lot of regulators and government entities have had, right? So anytime we become the data, right? We are the data that is going to sell something. What requirements are we responsible to? Are we responsible to an institutional review board, right? Which what we have is a federally designated entity in the United States that every institution has or is a subcontracted out to kind of protect human subjects. But no one's protecting me when they're selling me shoes, right? So where's the line between research data, commercial marketing data? And I think that's a very fine line. I will give you another little anecdote. Very recently, I spoke with one of our major network news stations in the United States, NBC News. One of the former American football players had went on to People magazine, highly popular magazine that you can find in a grocery store, and had asked the public to help him find a living kidney donor because he needed a kidney transplant, right? The news asked me, is this ethical to do? In the United States, it is, because we encourage all of our patients to be able to share their need and their social network. But it's easier for someone with a lot of celebrity to do that. It's very sad this football player actually died before he was able to get a kidney transplant. And that was kind of a recent, very sad news to hear. But I do know that because of his public ask, a lot of people called the transplant center that he was listed at, which is not my center, but another center in New York City. And I have friends that work there, and they were telling me that it's not only kind of for him, but what other opportunities would there be for someone who said, I want to be a living donor, even if I can't donate to this person, could I donate to someone else on your list or in a kidney exchange? I just came back from Brazil where this is illegal. You cannot do this in Brazil, right? You may not be able to do this in other countries. I'm not fully versed on all the laws around the world, but it's, Jerome, your question gets, I think, at ethics and opportunity. And is our data ours? And if someone thinks that I'm a generous person, is it okay for them to promote living donation to me as an idea that I might want to be a part of, just like I might want to be a part of those black stiletto heels that I'm interested in from whatever company is selling them to me? So I think you have, it's a very local issue, and the metrics for measuring success of social media campaigns, I think, really depends on the specific engagement of what that is. It's, if someone can ask for a kidney, what's the success? That people are calling the center or that they get a kidney? In this case, people called the center, but the person ended up tragically, dying.
Yeah, but there's real science about how to adapt the communication to the profile of people in front of you. And this is called marketing. So I don't see here, because the purpose actually, or what we do with that is the ethical issue, but the mean is different. And so the metrics is something, and the way to catch better the attention or to profile better the message and to organize better a campaign is something that is been done already in a number of subjects, and it could be applied in this. I don't see the ethical issues into applying tools and technologies. We said this is meeting, and Frances, this words, humanity or human people and stories meeting technologies. So this is the same. Is just melting human targets with technologies or techniques like selling or communicating, etc. Yeah, Frank?
No, it's very interesting discussion. I think we should utilize the similar metrics that the marketeers are using. I'm not sure about you, but I get really annoyed if I get offered all the watches in the world on my Instagram profile just because clicked, or not even clicked, but perhaps looked at something really briefly, and you keep getting it. So I think that's another risk of organ donation campaigns. If you get oversaturated because of these marketing strategies, then people may actually get so fed up with it, because the way it's presented in marketing and the commercialization thereof is, I'm totally fed up with it, and I don't want organ donation to be in the same category as the Macy's stylets or my watches, or the things that we like otherwise. I do think from a scientific perspective, it is really interesting to see who are the the altruistically motivated people that, I'm not saying that we should target them, but what sort of things may work for certain categories of people, because I think we're still too much blunt in our campaigns, and one size doesn't fit all. So in that sense, I do think it's important looking with marketing specialists, and I'm sure that's already been done, in at least to diversify the portfolio, what we're offering with diverse tools in social media. But still, we need to measure outcomes. And I was so surprised when I was looking into this, that actually looking back at the campaigns I was involved with, we thought it was successful if there was a lot of attention for it and a lot of shares on social media, because the social media impact can be measured. And also with the Black Donors Project, we were hoping, we said, let's be just very happy if we get more people referred to the center, and we can register that before and after. But I think our classic randomized controlled trial setup does work for some interventions that we're actually envisioning. So it's a mixture of all that, I think, that we have to improve on, and hopefully get this off the ground.
Yeah. I just wanted to add that
Yes, Augusto.
we have differences, regional differences, and as Macy's mentioned, there are some policies in Brazil that might be different from other countries, but we have some campaigns, for instance, a month dedicated to organ donation, and sometimes, let's say that a celebrity gets an organ transplant, and it decides to disclose the facts and go to the public and tell her story. So these are cues that help us understand that yes, we can improve by education and by spreading, leveraging information, creating campaigns and marketing. The need to be altruistic, to be kind to the next person, even if you don't know him personally. So all these those values that we share while building an organ donation system, they have to be somehow stated and brought to the community to make sure that there is transparency, that the system is robust, sufficient, and also very much trustful. So I think now and then, and this is probably one of the backfires of social media that we always have to be very careful with. Misleading information might also be a problem, and this is the reason why we have to be present on social media and in all the other medias around to educate and bring precise information about the system, the transparency, and the reliability of the system, so that people can keep trusting what is being done and participate eventually. Okay.
And thank you for your action. And it's back to your specific presentation of today. You were pointing out the facts and do's and don'ts about the transplanters, because you highlighted the fact that when it's some individual promoting on social media, then it's different ethical issues than a group or association, etc. And so, what do you think about this then? That's in the issues that are to say that it's not of interest or it's not for your own profit. So how we can differentiate communications from individuals that can be deserved or can be applied to promote efficiently organ donation or to help doing it versus the fact that it's going to promote maybe individuals that needs to have more lights on their activity. And what's the point of sharing your activity of today? Like I've done this thing, it's for your community, for your family. But what about sharing this? Is it something that we should forbid or we should limit or we should have a green light or red light before it's published? Because this is not at all the same type of use. Uh,
Yeah, again, so this is a very difficult question to be answered. But anyway, I think that education, and especially so in my experience, undergraduate students and the community, so social media is being used massively for the next generation to come. And they must understand that there are some rules to be followed. So there are so many universities nowadays that are trying to bring this to the curriculum so that they can inform, protect the institution, and protect their students from get involved or doing things that shouldn't be done, because this could also backfires a lot to the institution and to the one who is doing that. And in transplantation field, this is even more important because real reliability and trust is something that is negotiable in the transplantation field. So the information to be published, and when you decide to walk through in this universe of transplantation, it's quite important for you to follow your institution's governance policies, to know what the rules are, and so that you can make the benefit to the system and not the other way around.
Okay, it's interesting. We are just Priya. What do we do? We still, and see Frank. We are. It's 5 now. Well, local time here, so we can just Frank, just take your reaction on that, and please.
Yeah, I think we're emphasizing a lot of things about education of professionals in transplantation about social media. Absolutely true, and I fully agree with that. Also, just to give another real life experience, is that I'm very, very much careful with social media and how I use it. And I know in my previous workplace, at some point we took a picture because we had so many transplants in one day, and literally all the surgeons, all the registrars, everyone was working, and we were very proud. Someone took a picture of all of us, and there was a lot of things wrong with that from a professional perspective, to be shared because it was a social picture. We didn't want this to be shared, but it was sent to our general director of the hospital, who then put it on social media, which was completely out of context and, of course, not relevant and very wrong. And it could actually jeopardize all the individuals in the picture, because it was like people in theater celebrating whatever we had achieved. And it was just to show with each other how proud we were. And so that's also, it was really an alarm thing for me. You have no control over what people do with a picture that you send in a social context, and there was never permission asked. And it was a very difficult thing to actually convince that, very high manager in the system to take that down from Twitter. And just to say how important it is not to just the transplant professionals to be educated, but also everyone in the chain, because people are completely unaware of the knock-on effects it may have on individuals and even the field of transplantation.
Yeah.
Thank you very much. So Priya, I think there was no question online. Q&A, no questions. So we're good. Priya, there was, you think so we can stay there?
Yeah, I don't see any questions in the Q&A panel.
No, I don't see either.
Yeah, so I think we can close the session.
Yeah, so on behalf of the team, would like to thank the speakers. So Dr. Sullivan, Dr. Frank Dorr, and Dr. Augusto dos Santos Jr. For sharing their expertise today and this discussion that's still open. So might be continued in the future.
And thank you to all our participants for joining us today. We hope you're leaving today with new insights and ideas for using social media to advance transplant communication and engagement.
Okay, a very nice thank you as well for Professor Calaban and Jennifer Goverman for this organization and for the script, because there's a e-plug here where Carla is telling us what to say and how to react. So thank you very much, Carla, and Jennifer, for everything in the organization. Knowing that a recording of this webinar will be available soon, and we encourage to share it later on with your colleagues. So thank you all. The last word is for Priya. Please.
Thank you, Jerome. Thank you,
Okay.
everybody.